Hi guys, welcome back to my channel, Sweet Shawnee. If you're new, welcome. If you're old, welcome. Everyone, just welcome. Well, as you could see, I'm currently in my car, and I actually just left the doctor's office for my first visit in regards to the doctor for my bariatric surgery. Everything is moving a lot faster than I anticipated, and that's because my insurance only required 3 visits opposed to the normal like 5 or 6 visit. So I'm looking by summertime I should be the surgery is pretty much on the table right now if I just get everything done in whatever fashion. I also spoke to the nurse and my intake coordinator. They provided me a lot of useful information. I decided that I wanted to do the bypass surgery only because it's the most effective in regards to the weight loss, and I wouldn't get that acid reflux that the gastric sleeve does provide. So I'm really excited about that. Now for my surgery, let me get my paperwork. They gave me a whole folder, child. So my surgery, what I would need to do it is pretty much primary care clearance, which include a office note, my EKG, the medical clearance, and pretty much some lab work that needs to be done within 3 months of the surgery. I also need a psychological exam, so they provide me a list of psychological provider or psychiatrist, or even probably, I don't know, they provided me a list of providers that they work with. All they said was to provide the name of the doctor, and they would already know pretty much like the reason why I'm calling pretty much. Then I will need the nutrition visits. I know my old insurance required 5 to 6, pretty much 6. But my current insurance right now only requires 3 visits, and it's 1 visit per month. So pretty much if I do it on the 12th of this month, then I can't do it until the 12th of next month, which sucks because then I really have to wait longer. I thought I could just like pretty much schedule the earliest visit. I will also need a pulmonary clearance, which is a sleep lung specialist. I need a note from them. I already did like the sleep apnea, and I already have a provider. I just need to call them for them to provide that clearance, let them know I'm doing the surgery. So I'm already a step of the game. Some insurance, but my insurance doesn't require, which is the cardiac clearance. Thank God I don't have to do that. That's for patients 50 years and over, or if pretty much the doctor requires it. My insurance doesn't require that, so that's out of it. And some insurances also require weight history. So for the past 2 years, like what has been your weight? Have you been gaining weight, losing weight? I guess they want to see like what you've been doing, which none of y'all business, but you know, it's insurance. They want to make life so difficult. I shouldn't be talking because I actually work for insurance. But yeah, and then my insurance requires the upper GI. And then lastly is the consent signing with the doctor. So I'll meet my surgeon. I did not meet my surgeon today, guys, which is bummer because, you know, I would like to speak to the surgeon face to face, you know, get a feel to see if I like them. But I probably won't meet them until my 3 nutrition visits, because at that point I would need to get the clearance from the insurance and all of that. But yeah, so the last thing is consent signing with the doctor, where I'm pretty much like sign the date for my actual surgery and etc. So guys, I'm moving. Everything is happening. This is what I'm doing. My intake specialist did inform me to go ahead and, like, you know, start making some changes. I'm sorry if I'm shaking a lot. I'm holding the guys in my hand. So my intake specialist did inform me to pretty much like go ahead and make some changes. If I'm drinking like 2 bottles of water, make sure I'm drinking 4, because what some insurances, they're going to look at that and they're going to see, oh, okay, she weighed, for example, if I weigh 250 now and I end up weighing 280 by the time surgery come around, it's like, sis, what you been doing? You just been eating, drinking, not caring about it. They do want want to see that you're making some type of progress. So that's one of the main reasons for the nutritional visit. That's it. That's all the information I have for you guys. That was my first visit. My next visit is not going to be until the end of February, which is in the next couple of weeks. I'm going to try to see if I can make these call. My first nutritional visit is going to be February 19th. Take the whole day off of work and try to see if I could make some other appointments in that day, so I could just get some stuff out of the way. I'm going to go ahead and make these calls and see what I could do. Try to get some appointment. I'm also going to talk to my sleep specialist to see if I could get that pulmonary clearance for the surgery. And yeah, I'm on the path. I expect to do the surgery. I'm going to say, I did say May, but apparently when I spoke to the intake representative, she said that it might not be in May due to like how my insurance if my insurance answer everything. So she was more realistic than I was and said that it may be in June. So you know what, I'm gonna push it to June, but either way I have everything else that I should have. I just need to go to my provider, get them to get the clearance and everything, and yeah, bada boom bada bam ba bam. Yeah, so I'm gonna go ahead and make some calls, and this is the first video. Peace. Don't forget to like, comment, subscribe, and period. All right, bye guys.
A few moments later.
All right, so I just called to make some appointment based on the providers that my surgeon, the people at the hospital recommended. I mentioned I had to do an bariatric psychological evaluation before surgery. So they provided me 6 psychologists to call to make the appointment. They said, hey, just call them and let them know that it's for Dr. Steinberg and everything should be fine. Well, everything is not fine, okay? This is so frustrating because I'm trying to get everything done. I already called to make my upper GI appointment. Easy peasy, lemon squeezy. Why is the psychological appointment so difficult? Yo, mental health, they should not be doing this for people. Like, I know this is in regards to just my bariatric, but if I was a regular patient that's trying to get in contact with them, this is ridiculous. 2 of them are not answering the phone. I had to leave a voicemail. One of them said that they are, no, actually no, 2 of their locations said that they are not in network in regards to like, they don't accept insurance, which is crazy because the lady was like, oh, if you need that, it's $1,200. What? $1,200 when I could go to my therapist and probably pay like $60? You wildin'. We don't do bariatric evaluation. I'm not sure why they'll give you that information. What? So I'm gonna have to tell, like, I have it circled here, so like who I'm gonna have to like let them know, like, hey, if you're giving your patient these information, no bueno, no bueno. Luckily my therapist does do bariatric resource psychological evaluation. I did ask her about it. She did confirm it, but I thought that if I would go through, you know, the people that the hospital is pretty much like, you know, partnered through and they already know the process, that it'll be easier, because she said, oh, it's going to be through a different, like, you know, phone number I would have to call to make that appointment. But scratch that. I have an appointment with my therapist tomorrow. I'm gonna just complain about these other therapists because this is ridiculous. And yeah, and I let her know, like, I'm gonna have to have her do my evaluation, and then we just have to go from there. Like, this, bruh, this is ridiculous. But I just had to just like jump in there, say my 2